Great. So thanks so much, Ilona, for coming to talk to us about your latest paper. So first off, can you just give us a little bit of a background as to who you are and what you've been working on?
Sure. Thanks for inviting me. So I'm a circadian rhythm researcher, so that's my main focus, to look on health differences between different chronotypes and sort of also looking from childhood to old age, how circadian rhythms develop individually, and along the way how they're reflected to our life choices and well-being and health perspectives.
Great.
So that's sort of my individual focus in general, but my background is actually in biology, so yeah, it sort of reflects that sleep is such a multidisciplinary field, that we come from very different backgrounds.
Absolutely. Great. So then your latest paper, or the one we're going to talk about today, is then looking at long COVID symptoms, and you were looking at that within a large online survey, which you did across, was it 16 different countries?
Yeah.
So it must be quite a sort of a challenge in itself to sort of set up across so many different countries. Can you just give us a bit of a background as to how that went?
Yeah, this is actually a collaboration project that started at 2020 when COVID started. So we have in total 18 countries involved in this collaboration. It's called International COVID Sleep Study, so ICOSS, the abbreviation we use. So I wasn't alone.
Yeah.
So we have a core team that did the surveys, the first survey, and this is now dealing with the second survey. So I'm part of that core team that designed the second survey. And the whole collaboration is led from my university, or from the University of Helsinki. It's started by Markku Partinen, professor from this university, and he started to invite different sleep researchers from different countries, and I was invited from Finland. So I'm the main principal investigator from Finland with Markku. The collaboration consists different sleep researchers with different focus points, very esteemed professors involved with this collaboration. So it's a really nice project. So okay, I wasn't alone, but basically the survey was set up from Helsinki when we started to doing the online collection. So many countries use this Trix online platform that I was setting up with my PhD student, and a few countries use their own. But in a way, in each country, there was the principal investigator with his students orchestrated the data collection in that country. Okay. So in a sense,
a big collaborative project.
It was a very big collaborative project.
Yeah. Yes. Nice. Great. So then maybe you can tell us a bit about sort of what you were looking at and what you found.
Of course, the theme of the ICOSS is to look at pandemic effects on sleep, especially that was our main focus in the first 2020 data collection. And now in 2021, when we did the second survey, it was focused on long COVID and sleep. What are the pandemic effects on sleep when you reflect them, the potential long COVID effects on sleep? And when you look at the WHO definition of long COVID, it doesn't involve any sleep symptoms besides, fatigue that can reflect sleep deficits. But we wanted to add items and look more look from various angles on daytime functioning and sleep symptoms, problems, and individual timings of sleep. So what we found when we looked at different long-lasting symptoms, we saw that sleep symptoms, not only fatigue, but you look at daytime sleepiness as a reflection of potential sleep deficits, and insomnia symptoms such as trouble falling asleep or staying asleep. They were really emphasized among these long-lasting symptoms. We looked at 21 different long-lasting symptoms, and these sleep symptoms popped out as one of, when you looked at different ways, they were always among the 8 most common symptoms.
Yeah.
So either very common or at least among the 8 most common. And in this paper we focused on on looking at these differences between, of course, non-COVID cases as a control group, but among different severity levels of COVID.
Yep.
So long-lasting symptoms were emphasized on the most severe COVID cases that had required hospitalization. And among these, of course, again, sleep symptoms were emphasized.
And was it right that you almost saw sort of a dose response where the worse the symptoms were, the worse the sleep symptoms?
You could see sort of those response that the more severe COVID you had, the more severe symptoms you had, and sort of like this concomitant symptoms. This is not like, we have several papers coming out of this, and so this was sort of like initiative, this first paper, and we have already published the protocol paper that sort of describes all the process better. If someone is interested in reading that, I recommend as well. And we have papers popping out popping out like mushrooms.
Great. Then could you give us like just a quick sort of idea about what the other things you're starting to look at then within this population?
So of course the papers I'm personally working on is focusing on the long-lasting sleep symptoms and what is sort of the bigger picture of long COVID from that viewpoint. How are they sort of clustered together with different long-lasting symptoms, and preliminary results which sort of are in line with other findings is that it looks like it's a very multisymptomatic disorder, you would say. And sleep symptoms are really at the core of that. And sort of looking at then who are those people who develop this sort of long-lasting disorder, and what are the sort of risk factors for that, etc., etc. But what I think is really a strength in our study is that we have a very large general population sample across different countries from 4 continents. So it's really an international, or you could say almost global sample.
That's great.
And furthermore, it's a general population sample, so we can really distinguish between what are the pandemic effects on those who have not had COVID or who mostly have had like short COVID, acute phase without these long-lasting symptoms, and sort of look at these differences between different types of healthy or non-COVID cases, short COVID cases, and long COVID cases, and of different severity level, because papers, of course, have patient data that are collected from the hospitalized cases. Here we sort of, although it's only a survey data, but we still get into these nuances.
It's really interesting. I wondered also, is there plans to look across the different countries, like to compare sort of how things may be different or the same across different countries?
Yeah, there are, and actually I think we'll probably, once we get all the things we sort of planned, because there are a lot of different papers coming out, and we've already published on the first survey, I think around 15 papers, so please check those up. So we'll probably combine these data sets and sort of look at the development from 2020 to 2021, and also how potentially differences between different countries or different areas. So there is a lot of potential to look at these things from a very different viewpoints and with different research questions. So yeah.
Great. Well, it sounds like you're going to be very busy, and we look forward to hearing all the other work that comes out of this.
Sure. And of course, as I said, my own focus is on circadian rhythms. So already from the first survey, it was a very strong finding that especially evening types did have a more negative effects from the pandemic, because they already had much more sleep symptoms and mental health symptoms, and well, being also more young people among evening types, they also faced more financial issues because job situations may not be that secure as when you're a bit older. So it's sort of accumulated into being a high risk group of multiple different pandemic effects.
Okay.
But in a sense, that there was also a positive, that the flexibility that came from the working hours, you would say, that you have this stay-at-home period where you worked at home. So those who were able to work from home, they actually did a bit better, and a lot of their sleep symptoms were eased. Their sleep duration increased, and sort of their sleep-wake rhythm was more aligned with their individual circadian type. But again, as a general viewpoint, evening types did worse.
Okay. Well,
so we'll probably check also what are the risk factors of being evening type and having long COVID. So that is also one question, of course, we have.
Great. Well, thanks so much for talking to us about sort of a whole raft of papers there. So we've got a nice oversight of lots of different work you're looking at. Thanks so much for talking to us today.
Sure.
Thanks. Bye.
Bye.